Post-traumatic stress disorder is a disorder caused by exposure to trauma, emotional trauma, physical trauma, psychological trauma, and it causes a wide variety of emotional conditions and states.
Post-traumatic stress disorder, again, I'm no expert on the subject, but I think it mainly is a soldier coming back from a war, having a hard time readjusting to civilian life based on what they've experienced during a war, seeing horrific things.
So PTSD is post-traumatic stress disorder, and it's a stress response to a traumatic event like combat or potentially sexual abuse or any type of trauma that a person perceives as potentially life-threatening.
Well, I think like any emotional condition, PTSD affects people differently. Everybody has a different emotional and physiological response to stress or trauma.
Having not experienced it, I would imagine that you see some gruesome things in a war. You have friends die right in front of you.
I would say that PTSD affects the world through the stress response and like its effect on families. They're not doing just one or two kind of rounds of combat these days. They're doing 4 or 5.
As far as I know, the symptoms of PTSD, are anxiety.
Is that you're reliving the event, like something will trigger you and you'll be back at the event.
Self-damaging behavior.
You avoid stimulants or the stimulation of the traumatic event. So anything that reminds you of the event, the original occurrence of the trauma, you'll avoid that.
You'll react with different degrees of emotional disorders.
You have a kind of a negative change to your perception of reality, trying to figure out if there's a threat in their environment. And they often interpret little things in their environment as a threat. So I hope that makes sense. Okay.
I think it's detected by a number of means. I think, in most situations, PTSD is going to manifest itself as some sort of, damaging behavior or disorder, whereby the person suffering from the condition is either seeking treatment, and is self-medicating, or the person is, seeking counseling or asking for help. I think there's, again, a wide variety of ways that it's going to be identified and recognized in someone who's suffering from it. It varies, according to the individual. I think in regards to this large group of people that we have suffering from PTSD, our returning servicemen and women, I think that the armed forces and the medical community are recognizing that even if the person suffering from the condition isn't aware of the fact that they may be suffering from the condition, we have to work with them to identify it before some of these destructive or damaging behaviors can occur.
It is detected through seeing a therapist or a psychiatrist. They're trained to use the DSM, which I don't know if you guys know what that is, but the DSM is the Diagnostic and Statistical Manual of Mental Disorders. It's what all therapists and social workers and psychiatrists use to figure out, like, people fall into a cluster of behaviors. And so that cluster I was talking about earlier with the symptoms of PTSD, when you have that entire cluster of behaviors, the chances that you have PTSD go up. So that's how it's detected, is through a mental health professional.